Ross is next.
Thank you very much, Mr. Chairman, and to the ranking member. I request unanimous consent to submit for the record the New York Times article, GOP governors vow to close doors to Syrian refugees.
Without objection.
Thank you very much. I want to pick up a little bit on the conversation that my colleague, Representative Escobar, had about how we need to do both deal with the border and deal with legal immigration. I represent North Carolina's 2nd Congressional District in the Research Triangle. I want you to know I rarely hear about the border from my constituents, but I know because of my role in Congress and on this subcommittee how important it is to deal with the border. But I do want you to know that I hear from employers in my district every day about the need to fix our broken immigration system and allow more people to come here and work, either while they are waiting for their immigration status to be taken care of or under a legal immigration process which has a decades-long backlog. I hear this from our Chamber of Commerce. I hear this from the Farm Bureau. #1 issue for the Farm Bureau and agriculture is the #1 industry in North Carolina. I hear this from the Hotel and Lodging Association, and I hear this from the medical community. And I want to bring up, because we're talking about social services, some facts about our workers in the healthcare industry. According to a 2021 report from the Center for American Progress, approximately 365,000 undocumented immigrants worked in healthcare during the COVID-19 pandemic. In addition to providing needed care, they cleaned hospital rooms, served meals, managed front desks, and more. These are not the highly skilled immigrants that the tech industry is looking for. Rather than draining our social services, these individuals played and continue to play essential roles in our healthcare services. They did so at a time when healthcare and other social service sectors are struggling with worker shortages. Of course, this is in addition to the taxes they pay into the system. For the most part, they cannot access, particularly through Social Security. Imagine the tremendous impact these workers could have on our social services if our country expanded opportunities for these individuals to obtain legal status and harness their full potential and talents. Right now, we have low unemployment and massive demand for workers that U.S. citizens alone cannot meet. Yet we put up roadblocks in front of immigrants to work here. Our legal immigration system has not been updated for over 30 years. That means our legal immigration levels are still where they were when few people could even use the internet. I'd like to address a couple questions to Mr. Chen in my last minute. Are our current temporary worker programs adequate to meet this demand?
Thank you for the question. I would say our temporary worker permit programs, employment authorization programs for workers and for permanent are not adequate. And we have demand far exceeding the need for H-1B, H-2A, agriculture programs across the board.
And can you discuss how the creation of additional legal pathways can impact the numbers we're seeing at the border?
So expanding legal pathways would do tremendously in terms of improving both the pressures at the border to alleviate that, as the PRO program has done, but also to address the kinds of important employment and business issues that you've just been describing that are impacting the country. The fact is that both Republican and Democratic leaders across the country and businesses, the U.S. Chamber of Commerce, are asking for more legal pathways to enable people to come here. We've had a lot of talk about people not coming or coming in the right way. The problem is we don't have adequate right ways for people to come exactly to meet the kinds of needs you are talking about here, Congresswoman, to meet the needs of the country, both for families and businesses that would make America stronger.
Thank you very much, and I yield back.
Mr. Nails.
Mr. Chairman, thank you. The ranking